Hello everyone, and welcome back to another episode of 65 and Counting. I'm your host, Adam Fry. I'm a certified Medicare planner, and I'm here to ask the important questions that you want answered by industry professionals. This show is for anyone and everyone coming up on that important milestone of 65 years old. That means retirement, it means Medicare eligibility, or it means that you're just plain interested in the world of retirement planning. Whatever it is, on this show, you're gonna hear from the people that know it best. And we've got a very special episode today. Welcome back, everyone. It's the first of its kind for 65 and Counting. Today, we're gonna do an educational spotlight. This series of episodes is gonna cover different topics on the ins and outs of Medicare and retirement planning. And what better place to start than original fee-for-service Medicare? That's right, we're talking about original Medicare today. What is it? Where did it come from? What does Part A and Part B, what does it actually mean? What does it do? And what do people do with it? So let's ask ourselves, what is original Medicare? To understand that, we'll have to take a look at where it comes from. So we're gonna go all the way back to 1912, when Teddy Roosevelt was running for president. That's right, Medicare's roots are over 100 years old. President Roosevelt's platform included health insurance coverage from the government. Now that idea didn't really take hold under his administration. We've got to jump 30 years forward to President Harry Truman. Now, on November 19th, 1945, President Truman called on Congress to create a national health insurance fund that would be open to all Americans. President Truman was actually unable to get this through Congress. So we'll fast forward to John F. Kennedy. He made a push for a national health care program for seniors. And that was specifically for seniors because at the time, over 56% of Americans over age 65 were not covered by health insurance. Now, even President Kennedy wasn't able to pass funding for senior health care. We need to fast forward one more time to the Johnson administration. In 1965, legislation was passed for federal health care insurance available to senior citizens. And in 1966, Medicare was born. Here's a fun fact. President Truman and First Lady Bess were the first two Medicare beneficiaries. Their Medicare numbers on their cards were 1 and 2. Just kidding, I don't really know what their Medicare card numbers were. According to CMS, as of early 2019, there are 60.6 million people on Medicare, and it's responsible for about 20% of the national health spending. So what exactly is original Medicare, and what can you do with it? So original Medicare is Part A and Part B. It's health care coverage from the government, and it's made available to American seniors over the age of 65, people on Social Security disability, and people with long-term disabilities such as end-stage renal disease. So there are two parts. It's Medicare Part A and Medicare Part B. And it's easy to get lost in that alphabet soup of all the different aspects of Medicare. But today we're focusing on original Medicare Part A and Part B. So Part A, that's your hospital coverage. It'll cover you for things like inpatient hospital stays, skilled nursing facility care, nursing home care, hospice care, and home health care. Part A by itself will not cover the whole bill. There's still a lot of hospital charges that you could be responsible for. Now, most people will be eligible to receive Part A of Medicare for a $0 premium because they've already paid for it. That's during their time working. Remember that line item on your paycheck stub that says Medicare? Well, there you go. If you've got questions about whether you or a loved one are eligible for this, give us a call and we'll help. So let's move on to Part B. Part B of Medicare is your medical coverage. Part B covers two types of services. Now, first off, it'll cover your medically necessary services. That means services or supplies that are needed to diagnose or treat your medical condition, and they meet the accepted standards of medical practice. Also, it'll cover most of your preventative services at no cost. So those are things like illness prevention and detection in the early stages when treatments are most likely to work best. Part B also covers things like clinical research, ambulance services, durable medical equipment, and mental health care. For most people, Medicare Part B this year in 2020 will cost $144.60 a month. And based on your income, it could cost as much as $491.60 monthly. Part B has an annual deductible, calendar year deductible of $198 in 2020. And by itself, Part B by itself, you're still going to be responsible to cover about up to 20% of most of your medical bills. So that's Original Medicare. Here's the issue. There's a lot that Original Medicare does not cover. The first big one is outpatient prescription medication. Original Medicare does not include coverage on the drugs that you pick up at the pharmacy. So some other things not included on Original Medicare are dental exams, most dental care procedures, dentures, routine eye exams, glasses, hearing aids or other related hearing exams, custodial care, long-term care, cosmetic surgery, most chiropractic services, acupuncture, and routine foot care. And like I said earlier, in a lot of cases, you're still left with 20% of the bill. But fear not, because not too many people stick with only Original Medicare by itself. Why not? Because it could leave them exposed to a 20% liability. The solution to this is where we come in to help. So you don't have to be exposed to that kind of liability. You've got some options when it comes to your Medicare. You can keep your Original Medicare and add a Medicare supplement and a prescription drug plan, or you can transfer it over to an all-in-one plan with Medicare Advantage. We'll discuss these options in upcoming episodes. That's why I'm so excited about this educational spotlight. So, was all this information overwhelming? Do you feel like you still need some help? We're here for you. We're here to help you. We've got easily accessible online workshops that go into detail on the products available to pick up where Original Medicare leaves off. We've also got certified Medicare planners standing by to help you sort through this whole mess and help you find a plan that's most appropriate for you. So everyone, hit that follow button and go to 123easymedicare.com or call the office at 602-281-3898 to sign up for a workshop. They're going on right now. Or just call us and have all your questions answered. So thank you so much, everyone. I want you to tune in next week, and we'll see you then.